Welcome to Getting Better with Dr. Adam. Dr. Adam Silberstein is a clinical psychologist who has been working in the field since 1993. With a broad range of clinical experience, including state psychiatric hospitals, adolescent residential treatment with a trauma focus, the Department of Corrections, and in the addiction treatment arena. Adam is currently in private practice and serves as a clinical consultant and supervisor for a number of treatment centers. This podcast is for general information and entertainment purposes only. This should not be considered treatment advice, nor is it a substitute for an individual treatment plan. If you have questions or concerns about your individual situation, it is strongly recommended you consult a licensed professional to talk about things that are specific to you. If there is an emergency, it is strongly recommended you seek treatment at your nearest emergency room.
I just had a wonderful conversation with Dr. Deborah Sweet. In my community, when I think of trauma treatment and who my go-to person is, I certainly think of Deborah. She's trained in so many different modalities and weaves them in and out so beautifully and masterfully. And today we focused on a newer treatment that Deborah is working with called havening. And what an interesting, user-friendly modality, and with such capacity to reach and help so many people. Thank you, Deborah. I hope you all enjoy listening to Dr. Deborah Sweet. Hi, everyone. I'm here with Dr. Deborah Sweet, and the pre-game discussion has been kind of fun. I'm just being ridiculous, trying to set the tone for our conversation. And we came up with, I just want to be helpful. And I'll start by saying, welcome, Deborah. It's really nice to have you on the podcast.
Thank you. Good to be here.
So just a little background, my relationship with Deborah Sweet. When I came into practice, anytime I heard the word trauma in West Los Angeles, I heard the name Deborah Sweet. So it was just almost became, you almost became the same word to me, trauma, Deborah Sweet, trauma, Deborah Sweet. Everybody was talking about Deborah Sweet and trauma. And so it turns out that I discovered, not just by word of mouth, but by actually sending you people why that was true, and how I love sending to my colleagues who have expertise, and on certain cases when I really needed help, how rapidly, what seemed like an endless struggle for some of the people who are in my practice, how quickly those individuals were provided with relief when I was just so concerned that they couldn't get help. So that's how I've come to know the name Deborah Sweet and work with Deborah Sweet. But also, we're not even going to talk we're not going to fixate on trauma today, by the way. So what I want to talk about is this. And this is the overarching discussion. And maybe you could shed light on this for all of the people who are listening, both therapists and non-therapists. But here's the deal. Life is full of stress. We've seen it in the pandemic, right? We've seen a lot of heightened stress. We definitely, in all spaces that I work, there's an acuity of symptoms. Things are much worse, and people are dealing with stress. But even before the pandemic, a part of me as a clinician, a part of me thinks, therapy is really good, and it's nice to have a place to talk and share. But they've been talking about stress reduction for a long time. You can squeeze a ball, you can breathe a certain way, you can do a lot of things. But the people who are stress balls, really, do they really, really de-stress with stress reduction techniques? To people who are just wired anxious, and I'm not talking about I'm having a panic attack and I'm learning to not have a panic attack, and I'm adjusting that. I'm talking about people who are just stressed. Right? If somebody tells me just do yoga and have some miso soup, I don't know if that's maybe it'll help a little.
Okay.
So I want your take, and I want the overarching theme to be, is there really such thing as true stress reduction?
Yes. I would say there is, but I would also say there are some, let's call them techniques that are better than others. I've said to people, by the way, my father was a psychologist, so I grew up with it in the home. And, he was really out of the 70s, and it was a lot about feelings. And I always say to people, when you leave, I don't want you thinking, oh, I think I feel better. I know I feel better. How do you know you feel better? Because I feel different in my body. And of course, that would be the somatic therapy side of me talking there. But that overall sense of wellness, I think is really important. And even earlier when you were talking about trauma, it's not trauma. I mean, it is trauma, but it's trauma treatment. It's like, what are these treatments and how do they work? So in terms of stress reduction, since one of the main things we're going to be talking about today, hopefully, is the havening technique. There's nothing like it that I've discovered. Yoga is great. Stress ball, not quite sure about that one. Breathing, great. But anyway, yeah. So
just to
havening.
give some background, one of the things I like about when I send people to you is that there are so many different techniques and approaches that you have familiarity with, but lately,
Absolutely.
the newest generation of approaches is havening, right? That's getting attention,
Yeah.
and on
That
your
haven.
end, you're giving a lot of attention to havening, this
Yeah.
technique. So maybe it would be helpful in terms of the overarching discussion here to discuss why havening, what's it about, and how do you, just educate us a little bit about it.
Sure. Let me say that, something you said, it's true. I am, certified in somatic experiencing, EMDR, brain spotting, etc. But what's really interesting is, so havening came into the picture when I re-met a woman named Kate Truitt at a Bessel van der Kolk workshop. So we'd been EMDR partners 12 years before, and I couldn't believe 12 years later she recognized me, by the way.
Wow.
When I was talking with Kate Truitt about the havening technique, there's a book, by the way, which is called 15 Minutes to Freedom. It's very good. Kate started telling me about her experience with havening, and I thought, I don't need one more training. I've spent thousands of dollars, but I was so intrigued by her story that I went ahead and I got certified in it, and it has become a game changer. So let me tell you about what it is, okay?
So just before you go there, what was so intriguing about her story?
Oh, well, and since it's in the book, I think it's and she's very public about it. I think it's okay for me to say this. She shared a personal experience of trauma, and she had tried EMDR. She had tried a number of things, and it wasn't helping. And the trauma was her fiance passing 1 week before they were supposed to get married.
Wow. So
Yeah.
she is a clinician like you with expertise, and none of the treatments to the point of havening had worked, and she's sharing with you, this is the best thing I've encountered for my issue, and you're blown away.
That is 100% true. I was blown away, and I could relate to her trauma, which if there's time, I can get into my story a little bit later, but having lost someone close to me, it got my attention. Absolutely. Yeah.
Interesting. So what is havening?
So very briefly, and believe me, we could get into the neuroscience, which I am going to touch on for a second, but super briefly. So the havening technique is based in neuroscience, and it works with neural pathways to what we would call delink, or technically known as depotentiate negative events. So this is what I would say. If a person has written about it, talked about it, even prayed about it, and the activation, the feelings are not gone, this is where havening is particularly powerful. So if I'm doing deep trauma work, maybe I'm using EMDR or brain spotting, and there's some residual there, havening is what I go to. So it doesn't necessarily replace other therapies because people still need to work through, what happened. So here's how I explain it. Two doctors on the East Coast, Doctors Rudin, developed this technique over many years. And so let me describe it briefly in terms of the brain. This is super interesting. So you know this. There's a structure inside the brain called the amygdala, and it is the watchdog of the system. Its job is to make sure that we're safe, and it doesn't care about our quality of life. We take information in through our five senses: seeing, hearing, touching, smelling, tasting. Here's what's really interesting about trauma in the brain. It takes 75 milliseconds for stimulus to come through our senses and for the brain to decide if it needs to do something about this. So if a caregiver was mean and looked angry, your brain needs to decide, are they a threat? And if they are a threat, you want that input as quickly as possible.
Makes
Here's the
sense.
thing. But here's really interesting. It takes 75 milliseconds for something to come in, 350 milliseconds for the brain to get the message, I'm okay, I'm safe. But here's the thing. If a person has suffered childhood trauma from, let's say, an angry person, and they see an angry face, any angry face, their brain may hijack their system. And so, they can't see clearly. And this is why it can be difficult sometimes talking to a person who suffered from childhood trauma, because as you know, they go into fight, flight, or freeze, and they actually can't hear you. They're not receptive. You know what I mean?
Mm-hmm. Yes. So you're talking to someone who's already on high alert, right? And it could be as subtle as the wrong, somebody looks at me the wrong way.
Yeah, believe it or not, that's true. That's true. Actually, my husband and I have talked about, we both have this little thing where there is a particular kind of angry face that can be triggering. And we call it, I don't know if this is good, bad, right, wrong, but we call it the pinchy face. And sometimes, it's like, I don't know, somebody working at a store. And I suppose what it is I don't know, my projection of their judgment, which by the way, probably isn't even there. But if they have that angry face, I can feel a little something come up in my body,
Rapidly. And what you're saying to us is that the digesting that is super fast, right? Right.
Oh,
But
yeah.
determining that it's going to be okay is not as fast.
Yes. Well, and another way of saying that is the prefrontal cortex goes offline. And this is the thing, this structure, the amygdala, literally can hijack the brain. Also, it's interesting too, from the Havening perspective, it takes 4 things for the brain to encode something as traumatic. So the 4 things are what we call EMILI, but it's spelled EMLI, and it stands for event, what happened, meaning, what does the event mean, landscape of the brain, which has to do with if a person was in an abusive or neglectful home, this will create vulnerability in the brain. So we call that landscape, and inescapability. So this means, there are these neuroassociations. So again, if you see someone that looks angry, it could bring up again fight, flight, or freeze. Yeah. So something actually did happen. It can make the person very sensitive to future events. So we want to de-link the sensitivity, you could say. So let me tell you sort of technically what happens. And this is very interesting. So on the surface of the amygdala, there are these receptors, and they're called AMPA receptors, but I like to call them trauma receptors because they can create a trauma response. And there's a woman named Tam Johnston. You can find an animated presentation of hers on YouTube, and it's excellent. So here's the example she gives. If a person was afraid of big dogs and they have this trauma receptor, and they see a big dog, they're going to be terrified. But if that receptor wasn't there, they wouldn't be afraid. They might be concerned, but they're not, terrified. So this question is, how do we get rid of these or work with these receptors that make us overreact? And the answer is delta waves. How do we get delta waves? By applying the Havening touch. And this is something we can do for ourselves, or it can be applied by another person. So here's how it works. And I wish we were visual, but we're not, so I'm going to describe it. We cross our arms across our body, put our hands at the top of our shoulders, and we just brushing down from the shoulders on our arms. That's called arm havening. We can brush our hands gently against each other, almost like washing our hands. And then the third kind of havening is called face havening, and we can brush across the brow and under the eyes, kind of brushing out from the middle of the face out. So we've got arm havening, hand havening, and face havening. And for any listeners, you can look up Kate Truitt for examples on YouTube for you to see it. And also she has some videos people can follow along too. And this sensory input, by the way, it can change our moods, thoughts, behaviors. And it can work obviously with trauma, and it works really well. You brought up stress earlier. It's incredible for lowering stress.
So interesting. You go after the mothership of the issue, right? Using these delta waves to hit the receptor that's really, really the link to hijacking through the amygdala, right? Hijacking the brain, taking our sort of executive, discernment, robbing it of the experience, not in a mean way, just for threat.
Survival.
It's a threat.
Yeah.
It's a threat assessment, and it's become really important. So I could even and what's interesting is you use this, when writing and praying and other things and talk therapy is failing, right? This is a good resource for, hey, let's go after this a different way, where right? Let's approach it through a different avenue.
I love the way you just said that. And I will say that when it comes to trauma, frankly, I am not a big believer in regular, classic talk therapy for trauma. Get into my story, I'll tell you why, but it doesn't, I don't know another way of saying it, it doesn't provide the relief that some of these other modalities do. And something you said, you're right. Let me, and in therapy itself, by the way, so the way it works is, the client brings up the issue or the event that's disturbing, upsetting, angering, sad, or even cravings, which I definitely want to talk about in a minute. But anyway, so the person identifies the event or the feeling, and they rate it on a scale of 0 to 10, just like an EMDR. So, 10 is the worst and 0 might be, Zen. And then they begin brushing down on their arms, doing the havening touch. And this is combined with distraction games. So it might be picturing themselves walking and counting out loud at the beach or the mountains, counting items, naming what are 12 things you'd find in a music store? What are 16 things you would find in the produce department? Or playing games, playing sports. Let's play a game of tennis, and we're counting or humming songs like Row, Row, Row Your Boat, Twinkle, Twinkle, Little Star. Anyway, there's lots of variations of the games. So the person's havening, we're playing the games, then we take a moment, take a nice deep breath, exhale slowly. There might be some eye movements, like from EMDR. They're now saying that maybe they're not needed. I still kind of feel like for some things they're really good. And then we check and say, how would you rate it now? And what's interesting is, almost with exception, the number comes down, even if it's very slowly. And here's the thing. People report at the end they no longer feel traumatized by the event, or what they tend to say is like, it just feels like it's further away, or it's just not as important, which is phenomenal. Because sometimes the trauma they're talking about is, 15 years ago. And when they first start talking, it feels like it was yesterday. And we do this technique, if you will, and it feels it's like the brain puts the event where it was supposed to be in the past.
Right, because threat assessment of the amygdala is it's not really interested in time. Right. It doesn't. It doesn't have threat assessment is always right here, right now, and if that's the beauty of the protector. So the perspective that you re-engage the brain with is it could be put in its proper place, which is very interesting. It reminds me that if two people, if I want to do sort of a couples conflict, or any conflict resolution, if people are yelling and screaming at each other every time they engage, it's not really helpful. So this idea that you just have to get out your frustration and yell and scream at each other isn't necessary. I wouldn't call that a phenomenal session, right? If that's
some people think catharsis is great, and really catharsis can just jack up the nervous system.
Right. So a couple of things I want to touch on, and I do want to get to your story too. I want to just say you're using words like trauma, mood, cravings, stress. I think that for clarity for me, it doesn't really matter what the thing is if it starts to be entering a space of being hijacked by the amygdala. So if it could be called trauma, it could be called stress, whatever it is, it's an overwhelm to the system that loops me in a certain way that I can't access an ability to sort of to relax and calm through it and access different perspective. So to me, how do you discern? Does it even matter whether it's stress or trauma? What we call it, meaning the fundamental idea is the same.
Oh, I agree. And even the idea of, how disturbing or upsetting is it between 1 and 10? It's very subjective. So an incident could happen for one person and they could say, oh yeah, when that clerk was rude to me, that was a 9. And for someone else, they're going to call it a 6. It's subjective. So somebody else might say, oh yeah, it was stressful. Somebody else might say, oh, it was completely traumatic.
So I think it goes back to your point earlier that if it gets to the point of nothing's working and it's still recycling, whatever that thing is, if I'm super depressed and no amount of pep talk or self-talk could get me out of it, I keep saying my life sucks, or I'm so, I think I'm going to get fired. I think I'm going to get fired. And everybody says, you're fine. You're fine. What makes you think that? Well, somebody looked at me the wrong way. Right? Regardless of what it is, if it keeps recycling, then it's probably, for the therapist listening, it's probably a good piece of information that whatever's going on isn't working in terms of relief.
Oh, 100%. And it is hard when people have, looping thoughts and keep coming back. But I will say I've seen results, even OCD, but I've seen results with havening. I just haven't. I love brain spotting. I love EMDR. I love somatic work. Somatic work to me is the foundation of all of this. But havening there's something different about it.
So when somebody does havening, how many sessions do you typically see responses that you're happy with?
Well, interesting you should say that, because havening, one of the beauties of it, two things. It can be a standalone session. So somebody could come and say, I have something that happened. I want to do a havening session on this. So that's the beauty of that. All treatments, it depends on what the event was that they want to work through. And sometimes it's more complicated because somebody will have a feeling. They don't have maybe specific memories. And so that can take a little longer. And I'm having a third thought that is escaping me.
We're on. So what I'm hearing about how long it takes depends on the issue, like anything else. But in general, I'm hearing you, somebody who has exposure to a lot of different and familiarity with a lot of different techniques. Something is speaking to you about havening in a profound way. Is it that it's partly because it's so fast acting, or just that it works so well? What is speaking to you so much about havening when you have a whole arsenal?
That is a great question. Yeah, the speed of it is pretty profound. I could spend 3 sessions with someone in one of these other modalities, and in one session with havening, that activation can come down. And and once the activation is down, the prefrontal cortex can come back online, and the person, like kind of you alluded to it earlier, they can have a different perspective, or if it's just stress, stress can block the brain too, so to speak, so we want to bring ourselves back online. So yes, the speed of how it works, but also I should say this. So at the end of a havening session, let's say the person's, and I do have some success stories if you want to hear them, but let's say the person gets the activation down to a 0 or a 1. What I like to say is we'd split into what we call affirmational havening. By the way, there's a bunch of different havenings, which I can say something about in a minute. But affirmational havening would be, what I like to say to people at the end of a session is, what would you like to remember for yourself today or this week? And people come up, sometimes the phrase that they come up with is something that came out of doing the havening. So it might be, I am strong, I am safe, I am resilient, I am brave. Or it might be something like, today is a new day, I have, there are many possibilities, anything that would be an affirmation.
And something that you can carry away from it, that lives, that, that you sort of take ownership of, the asset that comes out of it. So yeah, it's interesting to me to hear somebody who's so jazzed up about a treatment. Is it this type of thing that the individual who's participating, because it sounds kind of like, woo-woo, touchy-feely a little bit, right? Does the person have to believe in it to work? Meaning the individual, if I'm coming in, I'm like, what is this? What is this? What is this granola type of, crystal bearing type of touch situation? Or is it more just like see it for yourself and experience it?
Yes, it's. Well, I think that the educational piece is really important. I mean, it is rooted in neuroscience. Is it possible that it could not work for someone? Yes, but those cases tend to be people that might have a personality disturbance. But for the majority of people, they absolutely see a change, whether they believe in it or not. And I have had people, be skeptical. And by all means, I'm skeptical.
Well, you were when you first heard it, until you heard about the trauma of your colleague that wasn't getting touched, and then it did work. So
absolutely.
So let's take it back to stress reduction. How have you seen it? And we'll sort of capture it in terms of your own experience in clinical practice. How have you seen it for just garden variety? Life is stressful. 2 parents working, kids, pandemic. How am I going to just get through 2021 and just life in general, even pre-pandemic? How does this work for stress reduction?
Okay, so actually, though, even using the pandemic, first thing we do is we identify, so what's the worst part of this situation, whatever it is, and we rate it on a scale of 0 to 10. And actually, this is a good time to say there are different kinds of havening. So let's say this is where it gets really fascinating. So let's say the situation, there's looping thoughts, like it's never going to get any better, or now everything, something like that. So and the mom might be doing event havening. There's another kind of havening called transpirational, which is to transpire. And this might sound a little science fiction, but we take a word, like I had one client and she had a lot of verbal abuse from her mother. And her mother used to say to her, "That's ridiculous," that kind of thing. So the word we used for transpirational havening was ridiculous. And the way it works is the person is havening, their arms, hands, or face, and they're repeating the word ridiculous. And you repeat it until it loses its meaning, or it'll start to change. And then there's a gentleman who came up with, he does a modified version of this, where it's alternating what was the feeling or the traumatic, let's say, phrase or word, alternating that with how would you prefer to feel? How would you like to feel? So it might be, the person might be saying like ridiculous, but then what they want, let's say it would be peace or freedom. They would alternate between the two using havening in a specific way. And the way I like to think about it is it helps move the material. It just moves it. So if someone's stuck, this transpirational havening, but that's something that's kind of advanced, let me say. But again, coming back to like stress, like you're saying, affirmational havening is amazing. It's going to be okay. I'm going to be okay. However, there's one other kind of havening I haven't mentioned. There's a bunch, but another one is what they call affirmational, which means what if? So let's say someone's stressed. What if today went smoothly? What if I had all of the faculties within myself that I need? What if something unexpected happens today? What if something good happens today?
So I'm clear for people listening.
Yeah.
Just the image I get is somebody's doing one of the 3 forms of touch continually, you mentioned. And as that's happening, you're introducing these alternative scenarios, right? As the person is soothing themselves in that with that touch, and they start to have a different relationship with experience, moving, shifting, right? It could be that they're taking out the punch of the word terrible, right? Or they're just or creating space, right, in their by first, right, addressing their body, as you said earlier, through the touch, of opening up to the idea of a different type of outcome or scenario than the ones that they loop out on.
Yeah, because the brain loves questions. So when you go with what if this podcast went really well? What if this meeting later today went really well? The brain starts to go in that direction.
Interesting. And if I'm a person who sees setback as potential doomsday, right?
Right.
And I say, oh my gosh, there's the unknown. It's terrible, terrible things are going to happen. You can just sort of choose an array. Which package of havening will you use, right? You'll decide which one, whether it's the what if questioning or affirmational, which one is going to be. And that's the clinic. It sounds like the provider gets to sort of see for themselves what's the best one would be. And the client patient gets to have the experience in the office and shoot for that relief. So
yeah, and also what's kind of exciting too is after a while they figure out which of the tools works best for them, which is exciting. And again, the thing I really, really, I think you asked me earlier, why do I love havening? It works fast, it's effective, but also people can do it for themselves. And I love that. If they're willing to do it, some people, and you can combine the havening with gratitude, like people write a gratitude list. They can haven while they're doing that. Because I think a lot of times, whether it's stress, anxiety, trauma, we're trying to communicate with ourselves. How do I get that message in? And also on a nervous system level, not just the brain, but how can I feel like, oh, it's going to be okay?
right, and to actually have the experience, right? And even if it's weird, right? And even if it seems kind of bizarre and touchy-feely, right? Just have the experience, and and you're believing in the experience. You can believe whatever you want, do it, and then assess how you feel. And if you feel better, it's obviously a good thing, right? No matter how bizarre it is, right?
Yeah,
That's the metric.
Yes. And I think it's also important to point out there's different kinds of trauma too. I'm not going to get too far into this, but if you think about it, abuse or neglect is very difficult to treat because it's about what wasn't there. So with EMDR, my experience, and mind you, someone else may have had completely different experiences, but when it's neglect, EMDR, well, I'll speak personally, it didn't do anything for that aspect of my life. But havening seems to interact with the system in a different way that can create healing for that piece, the neglect piece, where other modalities may not work. And there's nothing worse than being in a modality it just isn't working, and it isn't working.
So I want to get personal with you. You mentioned earlier that your experience sort of has informed your own interpretation of why this is good. What about your experience, and especially since it sounds like you've been down the road with your own treatment and so many different types of experiences, what about your experience personal experience is making this speak to you?
Sure. So, I probably came into this aspect of the field because I myself did suffer childhood trauma. And what it is I lived in 15 places between 1 and 8, which is a lot of moving, a lot of loss. And at one point, I was a year at my aunt and uncle's house, and then I was a year in a foster family. And while I was in the foster family, my father died. And 6 months after that, my mother put me up for adoption. So basically lost my entire world pretty young.
Wow.
So when I would go to classic therapy and the therapist would say, how do you feel? I just thought that was the stupidest question ever. How do I feel? How do you think I feel? I feel horrible. And then what it felt like in classic therapy is they would then just simply leave me there. That's how it felt. And I always tell people, like, I'm never going to send you into a memory alone. We have resource figures, which comes from the work of Laurel Parnell and EMDR or allies. So classic, therapy is fantastic. I love therapy for sorting things out, for talking things through. But when it's trauma, it's a different animal. And I will tell you that in about 1990, probably 98, I met a woman who did EMDR. And this is one of the things that we did. So I had this image of myself in this foster family in the backyard. And this is true. I was in the backyard and there were clovers. And so I was looking for a 4-leaf clover because I wanted to change my luck. And with EMDR, she suggested that I bring in my older self, my adult self. And so I pictured my adult self sitting there next to my little self with her arm around me. And basically she said, I promise you it's going to get better. You're going to be a grown up. You're going to get out of here. And I'll tell you, when I look back at that memory, I know I'm by myself, but I have my older self there. So that was EMDR. That was great. Then, if I may, with my father's death, I did somatic work on that. That was my first training, with Peter Levine. So when I thought about my father's death, it was like, do you know what black obsidian is?
Mm-mm.
It's lava rock that is very shiny. It's very sharp. It's heavy. They used to make arrowheads from it. The native people, if you will. So anyway, it was like this piece of obsidian in my chest, dark, black, heavy, sharp. So I started doing this somatic work, and this might sound funny, but the sensation in my chest turned into like a kind of a feeling of a loaf of wheat bread, like kind of heavy, but not sharp. And then we kept working somatically, and it turned into mist. It became misty. So when I think of my father's death, after that work, instead of it being like forlorn, devastating, sharp, it's misty. So that was incredible. Then with the havening technique, my adopted mother had a great deal of sadness, anger. She was extremely critical. And so with havening, we did what we would call an updating protocol, where we let the kid inside know that she got out of there, and that my adoptive mother's anger and sadness, so that belonged to her. That wasn't mine. That belonged to her. And kind of an embodied sense of that with the havening technique. So all of these things, by the way, they've all been building blocks and they've all been amazing. So.
Wow. That's it's such a refreshing to hear someone who's walked through something, right? Who's sat in different seats of different types of therapies and sees the evolution of treatment in terms of unburdening, and the unburdening that you experience in each one.
Yeah, I have a bird's eye view, I think, in that way, because I am certified in all this stuff, and it's the right tool for the right thing at the right time.
So, that's just really helpful to hear that you're not just a practitioner, but that you have your own user experience, and it's powerful. I just want to, before we close, I want to hear about one particular case of havening that just blew you away in regards to anything stressful.
Sure. Although I think to head towards ending, I would actually like to tell you, because I mentioned briefly that it also can work on cravings. And I listened to your podcast with Jack Saul, who I just adore.
Uh-huh.
And so I want to tell you about, and I think your listeners would be really interested to hear that havening can also work on cravings, and to tell a story to.
I have no problem pivoting. They are whatever, we'll call it stress, whatever is overwhelming in the system, be it a craving, be it a mood, be it a stressor, be it a trauma.
Yeah. And I mean, I've got story after story of people's, successes and, moving from anxiety to this, that, abuse, school, death, body dysmorphia, all kinds of havening stuff. But yes, let me tell you about the craving, how it worked on craving. So And I'll go ahead and I was very extremely skeptical about havening for cravings. So the night before the training, you're going to love this. I went to a party and they had snacks out, and they had an obscene amount of cashews, salted cashews, which I like. And at the end, they're like, "Oh, here, take some." So I end up with this huge thing of salted cashews, and I am studying before the havening training, and I go and I get a handful, and then you know how it is when a person might be in in a craving state of mind. Let's put it that way. So I get a handful, and then I get another handful, and then I start doing this pre-work with havening. And they're like, "Okay, so take a situation, write it down, give it a number." So between 0 and 10, I would give the cravings an 8. And the truth is, I was in the middle of eating them, right? Which usually in a situation like that, if I'm starting to do something like that, I'm going to
Do some damage.
thank you. Well said, sir. So, okay. So I start doing this thing, very skeptical, and it was an 8, a solid 8, like that craving, like, I just want these cashews. So, okay. And I start doing the havening, and it goes down to a 4. And then it goes down to, I think it was a 2. And then my husband came home, and I couldn't believe this. I forgot about the cashews.
Wow. So to give perspective, if somebody isn't a foodie, they wouldn't really appreciate that once you start going down a certain road, it's hard to stop. One bite of ice cream could lead to a pint, could lead to more. You stop that train in the middle, right?
It was a binge. It was straight up a binge. Yeah. So what's really interesting is, so the next day, I'm in the training, and they said, "Oh, pick something." And I thought, for what didn't feel like picking something too personal. So I picked the craving again. Here's what's really interesting. So they said, call up something, because we do, practicum, of course. So next day, I just had lunch. I'm doing this piece with this person, and I call up the cashews, I call up the craving, and I think it was, like a 7. Like I imagined that the cashews were in the break room, and we started doing it, and it was a 7. And then it dropped radically to a 2, which I'd never seen or experienced anything like that. Usually it takes a while. And then I suddenly realized I was full from lunch. This is profound because, again, what I call it the binging state of mind, it's a bottomless pit. It's just a more. And I almost want to cry, because it's like, oh my God, I suddenly feel full from lunch. Like I wasn't in touch with my body at all, if that makes sense. You know what I mean?
Yes. But what's so bizarre is that anybody who knows the experience of sort of being a hostage to a binge of any kind knows that doesn't get arrested midstream, right? It just doesn't. It just has to play itself out. And to be able to recall it, and then to be able to access put the brakes on is just very unusual. And and so I here's my takeaway from this, right? As somebody who works in the field, right? This application, we started off with stress, and what I'm hearing as you first of all, in your enthusiasm, which is very encouraging, right? But also that the application is so broad. And my takeaway is anything that is overwhelming to me, and it's not my job, it's the individual's job to say what's overwhelming to them, right? It could be what's overwhelming to you isn't overwhelming to me. And whatever that idiosyncratic thing is, based on your own history and your own memory, right? Whatever that is that comes to surface as an overwhelming burden, be it a craving, be it a depressed mood, suicidal thoughts, whatever that overtakes me, right? Whatever it is, that this application can give me broader access to using my good, sensible thinking by self-soothing, by providing this self-soothing, so I can access the part of my brain that can make good decisions. Because in that state of hijack, I don't make good decisions. And
people
makes sense.
People can go online and, look up, I think it's haveningtechnique.org. And also, by the way, also in the news, Justin Bieber uses havening. I don't know if you ever saw that. So it's very public.
Wow, it's the new type of investing in the world. If Oprah or Justin Bieber or anybody does something, we all say it's good. So that is a great
right?
use of contemporary influence. Justin Bieber does it now. I think I actually really do think that's helpful. So
I think it is.
I love it.
Somebody who's got a lot of stress, and he's found something that works, and he's shared that with the world. That's
absolutely.
wonderful.
Transcendental meditation certainly had a beginning in the Beatles using it. It was very, very helpful in it, and I think it definitely set up a whole wave of meditators. With that, the last thing I'm going to ask you is if someone wants to reach you. I know that you're a clinical psychologist. You also do resiliency coaching. How would someone reach you if they wanted more information or support?
So my website these days is drdebcoachingandcreative.com. That is probably the easiest way to find me.
Love it. Love it. I hope everybody heard that. And it was great to talk to you. I could have talked about this for hours and gone in many different directions, but I think I really have a better picture of it, and I'm very appreciative. So thanks for coming on.
I'm so glad. Thank you very much.
This podcast is for general information and entertainment purposes only. This should not be considered treatment advice, nor is it a substitute for an individual treatment plan. If you have questions or concerns about your individual situation, it is strongly recommended you consult a licensed professional to talk about things that are specific to you. If there is an emergency, it is strongly recommended you seek treatment at your nearest emergency room.